Hi, everyone. Welcome to NephCure's first annual virtual insurance access webinar. I'm so excited to have you all here so that we can discuss insurance access, especially when it comes to RKD patients. So today we have a few great treats for you all. We have patients who are going to discuss their experience with RKD, a patient adult, as well as two sets of patient caregivers slash parents who are advocating for their kids with RKD on a daily basis and yearly basis when it comes to insurance. We also plan throughout this to provide amazing insurance tips, tricks from not only their experiences, but also general things that I've seen along the way as a social worker and seeing how they've benefited our patients and help them navigate the insurance headaches and also debunk some myths in the way. So I'm Montrez Lucas, Associate Director of Patient Navigation here at NephCure. I've been at NephCure for almost 2 years, which is crazy to say. And I'm in Atlanta, Georgia. You will have my contact information at the end of this. So if you yourself need any assistance with insurance, if you're having any issues with insurance, in particular, and so many other things, but tonight, in the realm of insurance, if you have any questions, you can, one, post them at the end. But any specified questions, I'll also provide my email address so you can contact me personally and set up a time to talk and I can provide any assistance. So now that my spill's out the way, that's my part of the TED Talk. I first want to introduce Kimberly Queen. Kimberly is our adult patient tonight who's had a very unique experience with RKD and has been part of the NephCure family for quite some time. As a great advocate, an amazing volunteer, and somebody whose voice has been so beneficial. Tonight, she has agreed to join to share her journey with insurance, as well as some tips and some personal advice that she may be able to give due to her experience. Welcome, Kim.
Hello, everyone. My name is Kimberly Queen. I live in the Atlanta, Georgia area, Douglasville to be exact. I was diagnosed with FSGS at the age of 25. I am currently 37, but I have had a long road with FSGS, ups and downs. I was first diagnosed, I was noticing major swelling all over my body, especially in my face, and I was a pre-K teacher at the time. So eye swelling and teaching 4 and 5-year-olds is a little terrifying for them. So I went to my primary care doctor and I asked her about the edema, and she said, let's do a urine test. And they immediately saw protein in my urine and sent me to a nephrologist. So I was diagnosed, lucky enough that I was diagnosed early, but unfortunately, with my job of teaching pre-K and the start of it, when I got diagnosed, the biopsy did FSGS, and the first thing they do is prednisone. And unfortunately, I was teaching 4 and 5-year-olds at the time, and I ended up getting strep in my bloodstream. So I was diagnosed in January, hospitalized in March, and on full-time dialysis by September with FSGS.
No idea that timeline was that way, Kimberly. Goodness.
Yeah, it was very quick. So unfortunately, I didn't get a chance to really do a lot of the preventive treatment because prednisone was really the only option back in 2012. That was the first line. That was all you could really do. So I did that and I immediately started dialysis at the age, I actually started dialysis on my birthday, my 26th birthday. And my doctor wanted me to do home hemo because of being so sick the first time when I was diagnosed and everything I went through. I developed what they called steroid myopathy from being in septic shock. So I had to learn how to walk again, plus do dialysis at the same time. So he advocated for me to do home hemo. So I went through the process of doing it at home. And I did that for 2 years before my first transplant. And then I had my first transplant and from my brother, and it reoccurred immediately, the FSGS. I did plasmapheresis for 6.5 years, and then that kidney failed. And then I did PD. I was back on dialysis. I did PD for about 2 years before my successful kidney transplant now. So I am a year and about 4 months out of a successful second kidney transplant with no signs of reoccurrence.
Thank goodness.
Been through it all.
You've had a very colorful, if we say so, journey. Thank you for that. So in regards to insurance, I want to back up to, I started out as a dialysis social worker, so I know that when you go on dialysis, the social worker kind of starts out your Medicare application historically. So as being like a 26-year-old, you probably knew so little about Medicare. So that was probably the Medicare, correct?
Correct.
And so how did that impact, say, your RKD journey?
So I was very lucky since I did home hemo. I was at a really small clinic. My doctor advocated for me to go there for considering I was so sick, I was so young, he wanted me to be well taken care of in a small clinic. And the social worker there, she was so nice. She sat with me and she actually handled getting me set up with my Medicare, which, let's be honest, Medicare government insurance can be a headache in and of itself. And to have someone who understands the process, where to go, how to do it, what you need to fill out, it was a godsend because I was learning to walk. I had over 120 pounds of pure fluid on me. Like, the idea of trying to do anything else other than just make it that day to dialysis, there was no way around it for me. So I was so thankful that she walked me through it, told me that now that I'm on dialysis, Medicare is going to cover it. Like, I don't have to worry about that, which, let's be honest, um, I didn't have insurance at the time. So having Medicare and knowing that that was going to be covered and how expensive dialysis is was, like I said, a godsend.
Oftentimes, when people discuss Medicare in many situations, it's kind of like they say the golden ticket. It's like when it comes to doing insurance, you don't want to need it, but when you do have it, it kind of it covers a great deal with little option. You don't have to get when you have straight Medicare, you don't tend to need authorizations, which I'm sure you can vouch for. Um,
I've had a few times where I've needed authorizations because one of the medications I took, which is kind of a trial for FSGS, which it was Actar gel. So
uh,
they needed, it's normally taken 2 times a week, but my doctor wanted me 3 times a week. So I did have to go through the authorization of that. But luckily, like, Emory took care of it. The drug company that I did it with, they worked with me of like, hey, here's the information. Let me make sure to get it to the right people. But there was a time where I went a month without it,
yeah.
which messes with your numbers really quickly. So I've had a few times, but most of the time Medicare definitely covered it all.
Right. Yeah. And that I mean that is the upside of that in that situation. That is the upside of that when getting on straight Medicare. So you went from somebody who 26 diagnosed, put on dialysis, given Medicare, had a great social worker, which yay, one win for the social workers. And then you on this journey and you have now Medicare at 26 years old, which is really typically pretty rare for a 26-year-old. And then tell us a little bit about when you were so fortunate to get off dialysis and not need dialysis anymore. How did your journey with insurance change then?
So I'm currently dealing with that now. So after a successful kidney transplant, so my first kidney transplant wasn't considered successful because I was having to do plasmapheresis. So my doctor made sure I was able to keep my Medicare the whole time because there was no way I was going to be able to pay for Actar gel, plasmapheresis. So with this kidney transplant, they told me now that it's successful, no signs of reoccurrence, things are working great, that I'll have it for 3 years. So I am currently on year 1.5. So at 3 years, I will lose my Medicare, which means I will then have to start paying for my transplant medications, which are my life-saving, like, it's what's keeping me alive right now. And they're not the cheap medications, that is for sure. So it is definitely a thing where I'm having to think about, when I think of a job that I'm going to, start doing, I have to think of the benefits that these jobs offer. I can't just say, oh, I'm going to work. This job is great. Let's just start. Like, I have to say, okay, what are your benefits? What kind of insurance do you offer? Are you going to be able to help me cover this medication? And not only that, like, not even just my transplant medications, because of the FSGS, I've developed a lot of different comorbidities. I've had hip replacements because of prednisone. I've had fluid on my brain. I have a thyroid issue. And these are all things that I found out through my kidney disease or that are like side effects of it that I also still have to take care of. So it's not just my kidney stuff. Like it's now a whole lifestyle and like keeping up with everything. And so if I want to do all that, I have to find someone that's going to, have good insurance, have good benefits. And that's not something you think about. I mean, I am 37, but like for those 10 years, insurance was covered. I didn't have to think about it. I mean, honestly, I couldn't think about it because I was just trying to live and survive. And now it's trying to play catch up of those 20 to 30 years where I feel like it's pretty crucial for being an adult, like kind of growing into yourself and learning those key adult things. And I feel like I'm having to try to play catch up a little bit. Like, okay, insurance, who has good one? What's a good one? So it's definitely a lot to think about, a lot to take on, while also trying to be like, all right, I'm finally healthy after 10 years. I can finally do everything I wanted to do. So it's that balance of being an adult and taking care of these responsibilities while also saying, okay, let's live again.
It's almost like a blessing. That's what it sounds like. It's like, thank goodness, no more dialysis, but also,
Yeah.
insurance clock is ticking. And also, I think it's safe to, I think all of us can agree, both on the panel, within the community in general, at 37 is still almost took a few years off. That was great. 7 is when most people are starting new jobs and think about so much about insurance. They're thinking about, do I like my job? Am I going to like is this the right industry I want to work in? Do I want to apply for this job? The last thing to think about is, will this insurance cover all of my comorbidities as well as my overlooming transplant patients? So that's a very unique experience in general. How has this affected your mental health? This insurance, because this Medicare, I know this Medicare is, yeah, it doesn't sound like it'll affect someone's mental health, but in your situation, seemingly it could have.
Yeah. Shoot. It's definitely like,
Yeah.
you can't just, not everything's carefree. Like you have to think more long term, of like, okay, time's kind of ticking. I need to make sure that I keep this medication, because if I don't, I'm back on dialysis, and then I'm back on Medicare, but I could have just had it the whole time, and at least just for the medication. But so, I mean, it's just that worry that you try and put it at the back of your head, but still bring it to the forefront because you need to handle it. But like, okay, I got a year and a half left where I have to start like paying out of pocket for medication. And there was one time where my insurance had kind of like because I have Medicare and Medicaid, luckily, and my Medicaid had messed up. And so they were charging me full price. And I was like, I can't pay $1,000 for a month's supply of medication. And that was just one pill.
Your
And
Medicaid, large part of your medication, right?
say it again.
Medicaid helps out a large part of your medication, correct?
Yeah, so Medicare covers, I think it's 80%, and my Medicaid picks up the other 20.
Right.
And I was like, this was one medication. And I counted up the other day, I take 20 pills a day. And that was one medication. And I was like, there's no way that's life sustaining, $1,000 a month for one pill, for one medication. So it's that thing that's just constantly like kind of eating away at you. Like it's a constant worry. And I'm like, I don't know. You know what I mean? It's kind of like, where do you go? Like it's almost, you get it stuck. You know what I mean? Because it's overwhelming. You don't want to keep harping on it, but then also you don't want to like let it go completely.
I guess the overlooming question too is, not to put you on the spot, but time is ticking out. It's stressful. This insurance journey is one that is seemingly affecting many facets of your life, stress levels as well as financially, mentally. What have you started coming up with a rough draft of a plan, like a what if or what's next?
Um, I've definitely like thought about a government job, in the sense of they do have good insurance. My nieces just got jobs with the government, like being in that, and they talked to me about the benefits, and I'm like, that's something I could definitely do. I mean, it's not with a lot of people, because I was always told I couldn't go back to teaching because of the germs I got just from prednisone, and now I'm even more immune suppressed. And this is like my boyfriend, we've talked about it. just like his insurance and possibly me getting onto it if that, you know, comes to the point of us ever getting married. Like, it's just that, and that's a lot too. Like, I mean, him and I have talked about that. And that's a lot for like just talking to someone about your insurance, like things, and someone's willing, like he's willing to talk to me about it. And most people are like, oh, no, thanks. Like, that's too much.
If I can say, like, I'm like off record, but I mean, we're recording. You're saying some extremely real things that people aren't thinking about when it comes to insurance. This is like a unique path that an RKD, like, young person would have. It's social stuff too that it's affecting your life. So yeah.
Yeah, there's a lot of aspects that I would have never thought I'd have to talk about, like insurance, you know, future at 37, just with, you know, like a significant other that you have to bring up because like it's my life. It's not just something, well, this might happen. No, this is currently happening. This is what I've had to deal with. And if I don't handle it, this is what I'm going to have to go back to, and I refuse if I can help it at all cost. So let's try and talk about it now. And these are huge things to talk about. Huge things.
And they're atypical of people who are young adults who are working and making choices. Your choices are really anchored to this, which is a lot on you and in your journey. To that effect, what's a tip from everything that you told us and your experience? Say that there's another Kimberly out there. What's a tip that you would give her?
Oh gosh.
Regards to insurance and how navigating that.
Oh gosh, that's a hard one. I mean, talk with other people and just keep options open, like be open-minded and be willing to have these conversations. Because somebody might know of something that has good benefits and you never even thought of. And I mean, like I said, it kind of goes back to that, like who has good insurance, you know what I mean? And that's kind of what you have to think about. Like you can't just say, oh, I need this much money. And I think that's probably the biggest one is just look at benefits. I know that sounds so bad, but I mean, with someone who has a rare kidney disease, that this is life, this is our life, and it will always be our life, that we have to think about that. And so to just talk about benefits, I know it's a hard thing to talk about, especially when you're looking for a job, like, what are your benefits? But I feel like that's kind of something you have to ask because you have to take care of yourself in the long run.
Agree with you. I agree with you. And I'm grateful for you because definitely, I think that's as much as that may seem very common, it's not. People have, when they're hit with these RKD diagnoses, at any point in life, it changes all their lives, their whole family units, as I'm sure Marie and the Carols can attest to. But in your situation, and in many situations, it changes how you have to move in general. And you have to ask about benefits. To that effect, I'm going to share my screen for my tip 1. And that is, can everyone see that? Can y'all see that, everybody? Kim, can you see it?
Nope.
Oh, well, I have to click share, don't I?
Oh, here we go.
Got it.
So open enrollment. To kind of piggyback off of what Kimberly was saying, open enrollment, which usually, by the way, for everyone who's on the call and everyone who will be watching the recording, it usually begins around November 1st and ends usually sometime in January. I don't want to be firm on the time this year, but it's typically around November 1st. So my tip for patients with RKD who are having, who are approaching open enrollment is, prior to selecting an insurance plan, consider speaking with the insurance company and reviewing all your current medications, treatment protocols with them, as well as common treatment protocols for your diagnosis to ensure that they are covered by said insurance company plan. It's almost like you're interviewing them sometimes. You know, open enrollment comes. You want to kind of make sure that when you go to a new relationship with an insurance company, which sounds like we're talking about dating or marriage, but it is in many ways because it affects your year. You're going and you're approaching that. It's important that you think about what your unique needs are, as well as common needs for, say, FSGS patients and patients like that, or IgAN patients, or minimal change patients, it's also important to look at your current medications and ensure that they are covered. Though that this is idealistic, there is sometimes where you're learning information where you can be like, okay, that's a red flag. I should probably not sign with that insurance company because they don't cover most of the medications I'm currently on, as well as a procedure like a LDL apheresis or anything like that. They may not cover that. It's important that you kind of think about those things. Of course, you don't know what you're going to need, but the things that you do that you know are part of your treatment protocol, it's important that you ask questions before signing and moving forward with that insurance provider. Okay, that's the first tip. More to come. Next up, we have my friends, the Carrolls. They are an amazing family who came to NephCure a few moons ago. And we have been so happy to have them within our NephCure family. They also have a very unique insurance journey, which gives much insight into RKD youth and advocating for your child with RKD, and how that journey can be both difficult yet triumphant. And so I'm going to hand it to you, the Carrolls. If you can introduce you and tell us about your daughter, her diagnosis, and let us know kind of how it started.
All right. Well, I am Tiffany Carroll. I am the mother of Kelsey Carroll. She is 11 years old, about to be 12 years old, and she was diagnosed at the age of 3. And
my name's Ken Carroll, obviously the father of Kelsey, and this is our journey.
It's been a bit of a challenge. When she was originally diagnosed, she had gone misdiagnosed for a little over a week. I kept saying, there's something wrong, there's something wrong. And then, oh, she's got pink eye. Oh, she's got this. Nothing could ever really explain what it was until we went to her regular pediatric doctor, which was my doctor as a child. So he's, been through it all. First thing he said when he saw her is, she's got nephrotic syndrome. I mean, like, we walked in the office, he looked at her face and said, she's got nephrotic. She's got to go to Loma Linda. So he had a team set up for us when we got there, and it felt like, such a whirlwind. Here you're hearing this thing. What does this mean? And after being there for a whole week and meeting social workers and different people, and at that time we had a pretty decent insurance company, so it wasn't so much as trying to get approvals and all these different things. But about 2 years ago, our insurance changed and everything went by the wayside, unfortunately. So she had a relapse by getting stung by a bee. And at that point, it just went crazy. She is still in a relapse at this moment in time, but we had to get all kinds of approvals, and they didn't want to prove anything. And I had to fight and fight and fight and get a chronic case manager through the insurance company, and someone that would be on the inside that would help me navigate through this new insurance company that we didn't know a whole lot about. And after all these denials on the necessary things she needed, whether it be medication or treatments, it was almost impossible to get it done. So we started with rituximab, and they denied it and denied it. And it was so necessary.
She started her journey, like all typical rare kidney disease patients, on prednisone. Same thing. She went through the swelling, the bloating, the eyes, the puffy face, the just hair growth, just unusual things that, a typical 3-year-old, 4-year-old at this time shouldn't have to go through. And it was a challenge. We've gone through a plethora of different medicines. They're throwing everything they can at her just to try to get her into remission. At first, she was in remission, and then she'd relapse. Then she'd go back into remission, and she'd relapse. now we're at the point to where she's medicine, she doesn't absorb any of the medicines.
So with that being said, we had our first case manager, who was not an easy person to deal with. And thank goodness for NephCure, because
And Montrez.
yes, we went to our first walk down in Santa Monica because I happened to see it posted on another parent's Facebook page. And I thought, oh my gosh, we've got to get to this thing. They might be able to help us with some answers, because it's tough. These insurance companies can be so tough. And, back to Kimberly's comment, where it's like, you're just trying to survive, you're just trying to, here you've got this child, you don't know what to do, and you're just trying to keep them better every single day because you just don't have the answers. So we were both so frustrated. We went to the walk and everybody's there like, oh my gosh, you got to talk to Montrez. He's going to help you with everything. And lo and behold, you did. And we ended up going back and forth, getting supervisors involved, who has now navigated us to our current chronic case manager, Jennifer. And she is an RN herself. Mm-hmm. And she is not familiar with this particular condition, but let me tell you, over the last 2 years that we have kind of partnered together on getting all the things that we need for our daughter, she has done so much research on her particular condition. So she knows how to assist me in that navigation. And truthfully, with the insurance company, if I didn't have her, I would be so frustrated. So I feel that having someone like that on the insurance company side to advocate for you when things come to time sensitivity is so helpful, because all I got to do, she's a phone call away or an email away, and she just jumps right on the phone and gets to work and helps me out. So because of the prednisone, our daughter was also diagnosed with type 1 diabetes. So not only does she have this rare kidney disease, but she also is a type 1. So she's got two things kind of battling her, rare kidney disease, or her kidneys in general. So we have, multiple sets of challenges that we face all the time. And right now she's currently undergoing LDL pheresis because like Ken said, that she wasn't absorbing any of the medications. And after several appeals, we got her on to the LDL pheresis because, again, they didn't want to cover that either. So it is important to have someone in your corner on the other side as well.
Well, you kind of covered it, Tiffany. Thank you.
We're trying.
I say that parents oftentimes my coworkers, they're like my colleagues, like y'all are like a team of social workers. So I feel like I'm back in the hospital again because especially a mom who has a sick child becomes a social worker very quick. Like it becomes they become amazing advocates. So thank you for that. I did hear you say, I do remember the LDL for this journey and how that was a bit of a tug of war. Can you shed a little light on how that came, like how you navigated that process basically, and how you got to where you are now, and she's able to get that treatment with your current insurance provider?
So we had to have a secondary biopsy done because she was diagnosed at the age of 3 with minimal change. And because of this relapse, just being completely resistant to any medication, they wanted a secondary biopsy to see if she has changed into FSGS. And we did the biopsy and she is still diagnosed minimal change. So with some abnormalities. With that being said, any of the medications that she was being given, they would just increase it. I mean, she was on a pretty substantial amount of prednisone, which, as anybody knows, that does not work with type 1 diabetes. That makes your blood sugar skyrocket. So again, those double sets of challenges that we had to face, the doctors kind of had to come together and come up with the conclusion of, we've got to try LDL pheresis. And with that, again, the insurance company, because it's such an expensive procedure to have done, they want to know why. Why do we need to cover it? What's the reason behind this? How is this going to benefit her? So like I said, initially, they did not want to cover anything. We had to go through the appeal process. And finally, with our social worker on the other end, or our case manager, I should say,
Along with the doctors.
yeah, along with the doctors, they were able to get that overturned, and she was able to start that process. She is still undergoing that LDL pheresis now. She started in September of last year, and she's currently on that treatment twice a week still to this day. However, she was just put on sparsentan.
We're doing a clinical trial. Let me interrupt her and go back to, but you have to be an advocate for your own child, and you have to have a doctor that's on your side. There's a lot of doctors out there that are nephrologists, but they don't want to work the extra mile for you. They have to be willing to go to bat for you with the insurance companies. You know, there's doctors that will just put their hands up and say, oh, they're not going to pay for it, so we're going to try this. You have to have a gut feeling, and you have to have a rapport with your doctor and know they really do have your child's best interest at heart and your best interest at heart. Our doctor's been phenomenal. They've gone above and beyond. They've reached out to other team members, even adult nephrologists, and she's really stood up for us and gone to bat for us.
I agree with that.
Didn't mean to interrupt you.
Sorry.
You both tag team that pretty well. You kind of covered all my bases. I love that. Thank you so much. And I really think that it's important that is in regards to insurance that you do have an advocate on your side, and you do have someone that's in-house that maybe understands your situation better than anyone else. And also what I heard too, it's amazing that you've had a RN case manager within your insurance company that is now taking now somebody else sent to her with RKD may not have to go through such a fight.
Yeah.
You kind of help pave the way for another family or another patient, another individual, the same insurance provider that now they're not going to approach someone who's now more knowledgeable because of you all. So that's an amazing win, and we are probably all better for it. So thank you both.
Okay, thank you.
And I will be coming back to you too, because I have more.
Okay.
So you're not. So I want to share my next tip. It kind of piggybacks off of the Carol's experience. Can you all see that? So,
Yes.
manager advocate. As you heard the Carol say, that was a big essential part of them. Oftentimes in insurance companies, many people don't know that a lot of plans, I won't say most, but I will say a great deal of plans have case managers and or advocates on their staff. These can be RN case managers, they can be LCSWs, licensed clinical social workers, they can be licensed medical social workers that are included in these insurance plans. This to me is such an asset to your care, especially when you have a rare kidney disease, because these individuals can serve as primary contacts, which are meant to assist you in navigating your insurance plans, possible denials, and appeals. Also, which is a big deal in this, and I remember this distinctly with the Carols, is that having a person contact within the company, like a case manager, it prevents you from being on hold for hours and being tagged around quite a lot when it comes to all the press 2, press 3, and then you're also then reaching out to somebody. It's important that you ask when you are, but hopefully before you're forced to have a denial, and you're fighting for an appeal, that you see that your plan comes with a case manager. I would encourage anyone to get that, whoever that case manager you've been assigned to get that person's email address, so that when you're having an issue, with your insurance plan or an appeal or a denial, that you can ask them to check on the status for you as opposed to constantly calling and trying to see what's going on. Also, when you do, as many of you all may know or may not know, when you are doing something like an appeal and denial, whether it be a medication or a procedure like LDL apheresis or anything else, there are certain documentation that needs to be submitted. Having a case manager in-house that you can check in and say, hey, Tiffany, is all the paperwork complete for this? Do you have everything you think we need to place this appeal? Is there anything else pending? What can I tell my doctor needs to be sent from his or her office to ensure that the appeal is completely submitted? And also checking on the status, as well as they also can serve as an advocate for you. So it's important that if your plan comes with a case manager, that you ask for one, get assigned one, introduce yourself to them. I encourage you building a rapport with them so they can be your point person to save your family, you yourself, if you're a patient, a great deal of time as well as stress, because they can be your point person to this whole bureaucracy that is insurance. So yeah, that's my.
And I agree with what you said. We spent months and months going round and round and round until we had your assistants that said, oh no, we're going to get to the bottom of this. And you did. You told us, get it all in writing. And once everything got in writing, it seemed like the dominoes started falling. Before then, it was a phone call, or I can't help you, or I don't have authorization. I don't have this. Once you assisted us and told us these are the steps that we should follow, and you got involved, the dominoes fell. We got the case manager, and everything since then has just been kind of free flowing. So yes, I agree with what you said. It's a major point to help.
Thank you so much. Thank you so much. I'm glad you all got help and you are where you are. You also were, like I said, my coworkers. So I'm very happy to have that.
It was a joint effort for sure.
We had a very high-spirited conversation with the insurance company, but we got our point across. So yeah. It was a little honey dealt with that, dip it in honey. So I want to also thank you for y'all are helping me so much. The next tip is let me share my screen again. I think that hopefully you all have thought about this. If not, then appeal. I can't say it enough. It's important to appeal. Always know that when a claim is denied or medication coverage is denied, make sure you appeal the denial. You never know. I know I'm sure that it can be discouraging, especially when it's your child, when you're somebody like Kimberly who has their whole life ahead of them, or someone who just is tired of fighting and going through the rigmarole of insurance companies and dealing with RKD and you're sick and you're tired. It's still significant that you remember to appeal. It's so significant that you remember to appeal because there's so many medications, like the Carol said before, sometimes you may have a physician that went ahead and goes like, oh, we'll try this medication instead. They denied that. Advocate for yourself, advocate for your loved one, and stop them short and say, have you placed an appeal? Have you placed that appeal? Because oftentimes, if they provide enough information to these insurance companies, they may reconsider and overturn that denial, and you may get the medication that's probably best for you, or the procedure that you need, or the claim that has been denied for coverage. So these are things that you really need to, as far as advocacy for self and for anyone in your family that may have RKD, or in your network that may have RKD, or in your household that may have RKD, appealing is always the way to go. We have to appeal because it is much easier oftentimes for things not to be paid for as opposed to paid for. And so therefore, you appealing that denial and making sure that your doctor submits all the proper documents that the insurance company is asking for is so significant and oftentimes can change probably your life and your treatment protocol. So that's so important. Always remember to appeal when you have the ability to appeal. Okay. I think we have something in the chat. Yes, we will share the first chat. We will share the first to begin. Don't worry, I'll go through the tips at the end. So everyone who missed one or two tips or any of the tips, you will see them again, as well as my contact information at the end. So if you have any issues with insurance yourself, you can reach out to me, but you'll have that certainly at the end. So I'll make sure I go through the tips again. So last but certainly not least, Marie Carpenter. She's representing the Carpenter team, and my NephCure family now for a bit now too. Kind of new, but Marie has been around, and we truly enjoyed having the Carpenters part of our NephCure family. They also had a very interesting and unique insurance journey. Her son is Ethan. Can you introduce yourself, Marie?
Sure. I'm Marie Carpenter, and I'm representing my husband and I, even though he's not here right now. And we have a 16-year-old son who was diagnosed with FSGS when he was 13, and it was done through a biopsy. And let me see, what else there's so many things I could say, but I want to just narrow it down. The insurance plan we had did not have a pediatric nephrologist included in it as part of it. So his primary pediatrician had to refer us to someone outside of the insurance company, to a different insurance company, for my son to be seen. It turned out that once we started seeing that pediatric nephrologist, the two were supposed to really be able to connect and work together, the two companies, but that sometimes didn't happen. So for example, when we needed labs, I was told in the beginning, go anywhere you want, don't worry about it. But then at some point, the nephrologist said, I need labs done with me in my office or part of our insurance, which was not in our plan. So we said, okay, no problem. We're told we can go anywhere. So we did the labs, but what happened was we got a bill later on. And I talked to the doctor and that staff, and they said, well, sorry, you have to pay for it. That was one problem. Which was really, really difficult to deal with, because that's not what we were told. So now that we understand that they tell us exactly where to go, and I have to go to to the lab that they want me to go to, which is also challenging because a nephrologist feels like that lab doesn't give enough information. So it's really, really, it's been really frustrating. But the thing that really helped is like what the three of you have been saying is, like you, I found NephCure. And once I connected with NephCure, that's what really made the difference, because Montrez helped me find a doctor who could help. The problem was that doctor was not in my insurance plan either. When I went to my son's primary, and I went through, I don't know who she is. She's someone who helps, you have to get approval authorization to see different people outside of your primary. And I talked to her, and she said that there's nothing that we can do. You have to stay within the group of people that the nephrologist that we give you. And I said, but this one's outside of it. Anyway, Montrez, amazing, reached out to the doctor that was not in our plan. And he said, come, don't worry about the insurance, don't worry about any of this, just come, I want to see your son. And so we went, and he was amazing, because this is the other thing that I learned through NephCure, a really, really important distinction that I had no idea of. There's a difference between chronic kidney nephrologists and rare kidney nephrologists. And the time that we spent with the doctor that was who they told us we needed to see really was more lovely doctor, was really more chronic kidney doctor. And I didn't know there was a distinction until I got hooked up with NephCure. And I said, no, I need someone who knows rare kidney disease, because he kept saying there's nothing I can do. So just to backtrack, Ethan's situation is for his FSGS is related more to genetics. So we were told that prednisone, rituximab, all these other drugs I've heard so many other people taking, he was not going to be helpful. They did not want to do those drugs with him because they said they would not be helpful to him. It wouldn't help him. So there was no point in doing it. The frustrating part is we were told there's nothing we can do. Nothing. You're just going to have to wait until kidney failure. And I just said that doesn't make any sense to me. So it's very, very difficult to handle. But anyway, when we went to go see the doctor at we're in Chicago at Lurie's Children's Hospital in Chicago that Montrez hooked us up with, he was one to say, wait a minute, there are some things that we can try. We're going to try this and that. My current challenge right now is he has been great. We've seen him 3 times now. And he said, the next time I really need you guys to find a way for your insurance to pay for this. So now that's where I am. We're trying to figure out how we're going to continue to be able to see him. In the meantime, our son is going to be 17 next month. So next year he's going to be 18. So I'm trying to navigate what that's going to look like for him as an adult. Because I think 18 is when, I don't know if you can, I don't know. I guess I have to find out. You can see the pediatric nephrology, move on to adult. I'm not sure. But so anyway, that's another challenge. But the thing is, so I'm working on that. And I did not know, Montrez, that I guess the thing I need to really be thinking about is seeing if I can find a case manager, because the thing that I found that really helps the most is for sure advocacy and to advocate and having someone. So the one woman that is, I think she approves authorizations. She's been great. I call her all the time and she's been phenomenal and she's doing what she can. And the doctors have been great. They've written letters to the insurance company. We just keep getting letters back saying, no, we're not going to allow you to go to this other doctor that you need to go to. So I'm going to ask about a case manager or an advocate or social worker. I'm going to call tomorrow and ask them to see if I can find someone who will advocate for us so we can continue to see this other doctor. So that's kind of where we are right now.
A conference call.
Oh, there you are. Yeah.
Sorry, I said you can call me tomorrow too. We can do a conference call.
Okay. All right. That would be great. Yeah. I don't know what we would do without Montrez and NephCure because it really has made a difference. So when you talk about what relieves stress just feeling better is really knowing that you have support. And the kind of support that NephCure gives is really, really meaningful. It's not just emotional, but it's real, like real things can happen. And so that I really appreciate that. It's really made a huge difference for us and our son.
Thank you, Marie. Thank you a lot. And also, I mean, I think it's important to know I feel comfortable from the NephCure side saying that without our families, without our patients like Kimberly and all that, unfortunately, you all go through a great many plights, whether that be insurance or even bigger than that. But as you all experience those things, we are lucky enough to be able to build resources to provide other families. Every new problem brings about a new resource. And so every time we get a caller, every time we meet a family or a person with RKD who has a new problem that either we've not come across yet, it builds a resource. And I promise you, like clockwork, a week later, we get another patient with the same problem. It's like, aha, thank goodness for Marie. Thank God, thank goodness for Kimberly and her journey experiencing Medicare as a 26-year-old. And now looking at it as now as a 37-year-old, and also the Carrolls with their experience with a very unique insurance company. and then going to LDL pheresis. So because you all come to us and we've been able to meet one another, we've been able to help so many other patients as far as especially insurance, but with so many other resources outside of insurance in so many ways so we're very grateful for you all as well. But something that Marie said brings me to my next tip, and is like I feel like I'm the weather transitioning. So I'll share my screen for tip 4. And that is using research articles as support for your appeal. This is a little secret weapon that a lot of people may not think about. Because it is RKD, through working with different insurance companies, one thing I have encountered and one thing many of our patients have encountered is that oftentimes you meet case managers. And I think that Carol said something that is so massively important, is that they met an RN case manager who had never heard of the RKD diagnosis their daughter has. And you would be surprised how many times that happens. A lot of people in the medical field have never heard of FSGS, minimal change. They've never heard of IgAN. I remember a story that Kimberly told us when she would go to the medical school for a talk. And now you are so excited to now know that now so many of those fellows know what your RKD diagnosis, they know a bit about it, but not too long ago had no idea what it was. And so if sometimes the doctors don't know and medical professionals don't know, then it should not be that stretch of knowing that also insurance companies don't know. So therefore, sometimes they are quick to deny. If you or your physician, or you can contact us and you're looking for research articles to support your claim, that's the secret weapon in all of this that can really serve as a space of advocacy for you. So before filing an appeal for denied procedure and or medication, either you or your nephrologist should include in your appeal an unbiased research articles that support the effectiveness of the treatment. So if you have FSGS and there's a certain medication that comes out and your insurance company denies it, if you can also sandwich that appeal with research articles that are unbiased showing that this medication has helped patients, that strengthens your claim and really helps out your case in that way. I'm not saying it will always work, but I'm saying that's a lot of people don't know about that. And so sometimes some claims I'm sure are lost and denied because that's not sandwiched together with that. And so I think it's very significant that you include that. In Marie's case, in regards to Ethan, another thing that may help is showing where his labs were, how he was affected by his RKD diagnosis, and now after seeing the physician that was out of network, where they are now and how he's doing now can also serve possibly as well as support for her claim for them to fund and pay for it out of network physician. So I think it's important that you know that research, documentation, labs, hard numbers also serve as great support for your claims when you've been denied. Okay. So before I share those 4 again, I want to ask, does anyone in our audience have any questions for any of our panelists at all, whether that be Kimberly in her situation, any tip that she may give, the Carols or Marie Carpenter representing home base, the Carpenters? You can put your question in the chat box if you have any questions for any of us whatsoever in regards to insurance or anything you may be thinking. And I'll also provide my name and my email at the end of this, so you can reach out to me as soon as you get a chance, and I'll be sure to assist. But in the meantime, any questions whatsoever? While you all do that, I will also go on to my very last insurance tip. Oh, we do have a question. Sorry, never mind. One question is, how does one deal with coverage of experimental procedures that insurance typically rejects? What I would say is having that physician too, as far as documentation goes, provide one thing that Marie said that unfortunately has not been successful yet for them. But her case is a bit different. I would say having that physician write how this procedure that may be experimental may help said patient, and how other procedures that have been used that may be more typical, which is very difficult when it comes to RKD, how they have not worked. I think that's very important, as opposed to just making a blank claim for an experimental procedure, I think it strengthens the case when you show what's already been tried and how that's not worked. So what they probably would have typically approved has not worked. This patient is still in critical condition. I also encourage, because this is RKD and it is still so misunderstood, I think that oftentimes what happens is that because it's not something like a common and well-known cancer or oncology in that way, people don't oftentimes take to heart, or insurance companies, how sick and how ill our patient population really can be. So in saying that, I say that to say that providing that you've done everything that could work or would have probably been paid for or covered by your insurance company, showing that that has not worked and that the labs are still where they are, and having that doctor write in more critical care language is what I say. That's my self-point little thing. So, I mean, it's not like an overlooming thing, but having that doctor write with a sense of urgency, saying that this could be a life-sustaining procedure. This could be something that sustains this patient's life, same as like a dialysis would or chemotherapy would. Strengthening that language as opposed to just writing a blank claim is very important. I know that oftentimes on the patient side, it's kind of scary to go and ask your doctor for what they wrote or how the claim looks, but you urging them to write this in a more urgent manner, saying that this could be life-sustaining, also catches the eye of many insurance companies as well. Even though this is RKD, it's important that if you're able to have a procedure that could be life-changing and life-altering and sustain life, then it's important that that's written. That's not a far stretch. That's not being deceitful. That is, if you tried everything that is typically tried, especially in the Carol situation, and now something else needs to be tried, and they're not willing to pay for it. If you can prove that you've tried everything you can try, and now this is life-sustaining, and this could be life-sustaining, I think it's important that that language and that verbiage is used in documentation for these claims. Does that make sense, everyone?
Yes. Mm-hmm.
And also, the insurance isn't the end all in our current situation. As we stated, our daughter's now on taking an experimental drug. It's called sparsentan. It has been FDA approved for adults, but they haven't had enough research or clinical trials completed on pediatrics. So our insurance, speaking of our nephrotic daughter, she just walked in the room. Sorry. Our insurance denied it, even on appeal. So what our doctor did is they wrote letters, produced all the information as you were speaking of, labs, what have worked, what hasn't worked. And we actually got approved for compassionate use through the manufacturer of the drug. And they are providing the drug to us for free, which was about $3,000 to $4,000 a month for the drug. And they are now covering it for us on a clinical trial basis. So the insurance isn't the end all.
I do want to say to the audience that is watching, I swear these people have not seen my slides or my tips, but they keep on. I swear, this is like, no one's seen this, but this has worked out perfectly because every time you all,
we've been through it all. That's why.
We're telepathic, Montrez. We're telepathic.
Hey, listen, I told you you're my coworkers, so I'm grateful. We're all working. The next patient assistance programs by way of the Carols. There are many medications that RKD patients are prescribed that have income-based patient assistance programs, as well as, I should have added, compassionate care oftentimes too, that will be covered financially by the pharma company. The criteria for these patient assistance programs can be liberal, thus allowing many patients to qualify. So it could be sometimes where you could be denied. I'm not saying that you won't be based on income, and also that you won't be based off of age, because oftentimes for RKD youth, there are not a whole lot of approved therapies as well as, say, clinical trials compared to, say, adults. Marie has encountered that, and so have the Carols. So asking about the patient assistance programs, if you are prescribed a medication that you are unsure that your current insurer will cover, it's important to ask about any possible patient assistance programs. We had a family about 2 weeks ago a mom, and she had been denied insurance. Well, they didn't have insurance at the time, and she applied for the patient assistance program online, and it was about a 10-minute application. And within a few days, her doctor's office, the patient's doctor's office checked in on the status of the application, and they were covered 100%. So from not having insurance to then being covered completely is life-altering. But also, within these programs sometimes are compassionate care programs like the Carol spoke about as well. When being proven, when giving things like research, strongly worded and high-spirited letters from doctors, as well as social workers, could really help the case and build the case so that possibly these medications can be covered, even when insurance is being difficult or giving you pushback. So that is my tip regarding that. I would like to also, let me see if I can just click through. One, that's my name. That's my email address. So please feel free to email me at any point. I respond pretty quickly. If you have any questions about your insurance, any insurance headaches you may be having, any things that may arise, or anything even outside of insurance that you may need assistance with, whether that be financial assistance, genetic testing, medication access, mental health support, our support groups, as well as financial resources and what have you. Every new problem brings about a new resource for the whole RKD community. So there's no problem that we're unwilling to hear or any issue you're unwilling to hear. But tonight, discussing insurance, if you are in the midst of an insurance headache or you just want to know more about your insurance provider, how to navigate it, open enrollment comes in a blink of an eye. So if you want some help and some tips on how to navigate open enrollment, please reach out, please email me, and I'll be sure to get to you. We can set up time to speak, or if I need to just send you over a resource, please don't be shy, please reach out. I will also go back through a few of our tips. Patient assistance programs. Many of these medications have patient assistance programs because oftentimes the manufacturers want patients to sign up to these medications, and they are groundbreaking medications. And so in many ways, you applying for patient assistance programs may benefit you in many ways. Insurance is not always the end all be all. Those patient assistance programs do exist for a reason. They are there to help. So please apply to them, ask about them once you're prescribed a medication. If you want to ensure that your insurance company will deny it. If your insurance company does deny it, still ask about them. Requesting a case manager and advocate. Listening to especially the Carol story, case manager as far as in-house with the insurance company really served a great deal and also saved them a bunch of stress. They started out being press 2, dial 1 kind of people, and now they have direct contact with the insurance company. So that's a big, amazing win. So please ask about your insurance company's benefits. Ask if they come with a case manager. Ask if they come with an advocate. It may be a social worker that's your case manager. It could be an RN case manager. Regardless, build a rapport with that person. Help them to help you navigate your insurance denials and appeals, as well as your benefits in general. They sometimes are the key that unlocks the door to all your benefits. Using research articles for your appeal to support them. So along with having your doctor and your doctor's office file an appeal, oftentimes discuss with them the possibility of including research articles with that. Unbiased research articles that show numbers, that show and give instances of data where certain medications or procedures have helped as far as treatment protocols, RKD patients. So that's really important to do. That strengthens your case when it comes to combating something like a denial. Of course, it goes without saying, appeal, appeal, appeal. It's almost like fight, 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 go, go, go.
Yeah.
Do. Like it's definitely a big thing. I know, and I don't think a lot of people, I know it's easier said than done to appeal because I know that sometimes the journey is exhausting and you are tired of the fight. However, appealing can be life-altering. If you encounter a situation where you've been denied a medication, whoever is on the end of the phone or whoever has written your prescription, ask them about an appeal. Advocate for yourself or your loved one for that appeal. those, was that 5, y'all? Let's see, they're out of order because they were based on what you all were saying. Thanks, Marie. Well, I think that's it. So, any questions? I really encourage you all to reach out. Please email me. I will share our going away screen will be my name and email address. And also, before we do log out, I really want to say thank you to Kimberly Queen and sharing your amazing experience and being such a great part of NephCure and our NephCure family, as well as sharing your insurance struggle in general, and know that we are here for you to make sure that we push for you as well. Also, to the Carols, thank you so much for not only your bravery in sharing your journey, but also in everything you've done to contribute to NephCure by sharing your knowledge and your experience, and particularly tonight for insurance, because you have quite the story, and we are grateful that you all have shared that and quite the journey. And of course, Marie Carpenter, representing Team Carpenters over there. Thank you so much for sharing your journey time and time again with us and allowing us all to learn from it. We've been greatly honored and better for it. And once again, my name is Montrez Lucas, Associate Director of Patient Navigation at NephCure. Please feel free to email me with any questions and needs, and we'll be sure to assist in any way possible. Thank you all, and to all a good night.
We thank you, Montrez.
Thank you so much. Good to meet you all.
Pleasure. Thank you.
Bye-bye.
Bye.
Bye-bye.